Good morning, everyone. I hope that you and your families are all staying well. I miss seeing all of you in person, and I hope that will change later on this year. But for now, we're doing virtual communications. So before we get started, I'd like to mention two items. First, I want to reassure all of you that it is not our intention to furlough or lay off any employees during this pandemic. The second item that I want to mention is that at times I know it may seem as though we are being strict in some of the steps that we're taking due to COVID, but it's basically being done to try and keep all of you safe from any harm. So I know all of you are trying to balance your health of your families, your own health, and also the changes that we've all had to make outside of work. So I just want to take this opportunity to thank all of you for your continued dedication to the organization and supporting our patients and our families and each other during this time. So for those of you that are on the front lines of COVID, we appreciate everything you're doing, and I'm very proud of you all. So let's get started with the meeting. So I'd like to welcome our new employees. So on the Orange team, we have several new employees. We have Katie Smith, Kelly Rednauer, Melissa Hill. They are all hospice aides. Amanda Wiley is our new social worker, and Sherry Liebold is our new weekend on-call RN. On the Marion Blue team, we have two new field staff RNs, Alicia Ewell and Jamie Enlow. So welcome to all of our new employees. Under education for this month, there are several links out there. You've probably received the emails on the Relias Education. There are 3 items on COVID-19, coping with COVID on the front lines, COVID-19 for May, and also how to deal with anxiety during COVID. So those are all different seminars that you can enroll in yourself, and you just need to go to the Relias link and do that. So please watch your mail. There's going to be some more SOPs that are going to be updated. There's some new ones that we created and some changes to the emergency preparedness plan due to COVID. So those are going to be coming out soon. How you can protect yourself from fraud during this time. There's a lot of fraud going on with the COVID right now. So please watch out for beneficiaries that may have had requests for their Medicare or their Medicaid numbers. There's unexpected calls and visits that people may get about people trying to sell COVID supplies. Your healthcare provider, your physician should be the person that's assessing your condition and approve any request for COVID testing. As far as quality and performance improvement, the live discharge PIP, we saw a slight decline from 87.2% to 85.63. There's a lot of focus going on right now in the public health emergency. So we don't really have any further updates on that at this time, but if you have questions about the live discharge requirements, please use that live discharge quick reference guide or talk to your supervisor. I'd like to share with you some of the positive comments that we have gotten on the surveys since the release of the last time that we met. When my mother died, you were very helpful. When my wife died, we received the same superior care and understanding. Thanks again. Your grief support calls were very good, kind, and compassionate. Thank you for your service. Having a hospice nurse when he passed was a blessing. She drove on icy roads several miles to get to my home. I don't know what I would have done without hospice support. Everyone was so good at their job and helped me through a very difficult time in my life. I will always be grateful. The hospice team was wonderful. I really appreciate their many acts of kindness. It helped me greatly in my time of sorrow. Excellent support from Grief Support Services. Thank you. So kudos to all of you for all of these positive comments. You're doing a great job. Under employee recognition, many of you have probably already seen the email that went out on the Hospice Heroes t-shirt. that you can all order one of those for free on behalf of the organization. I just want to thank Chris Lidekin for designing the shirt, and for Tasha DePro for recommending the suggestion in the employee portal. So again, thank you all for everything that you do. In the clinical area, your safety remains a priority. So please continue to wear your PPE equipment at every patient visit. Also, we expect to have a survey this year, so the documentation is crucial for any type of visit, whether that's an in-person visit or a telehealth visit, and also the plans of care. And then a special thank you from Floria for everyone on the front lines who's worked very tirelessly during this whole COVID pandemic. So again, you're great examples of the Burgundy way. So keep up the good work. Development, we have canceled all special events until further notice. We do have a virtual event that we're hoping to get off the ground in the near future, but I don't have the details yet on that. June 1st is our drawing for the iPad. For those of you who have either done payroll deductions or made a donation to the organization, that drawing is June 1st for the iPad. And also December 1st will be the drawing for the Roomba robot vacuum. So if you have any questions about donations or anything, please contact Jen Lee or Jamie Anderson in accounting. From health information, Kellen just wanted to remind everybody, please be on the watch for these fraudulent types of email that are very frequent during pandemics and things such as this. So be on the watch for that. Under human resources, please keep in mind that you can use the Minds and Associates for various articles, webinar, any help, any de-stressing that you might need during this COVID time. So please keep them in mind, and also keep in mind that your HR department is here. Just reach out to them if you need any assistance. One other thing, we are going to be migrating to a new payroll system, and that is going to be effective July 1st. We are going on Kronos Workforce Ready system. We already use Kronos for our HR system, but this is going to be for the payroll side of it. So there are going to be some changes, and that is going to be communicated. It's probably already been sent out on Relias for you to look at the updates. So PTO and EIB in the past have been accrued based on budgeted hours. So going forward on the new system, the way that it calculates it is based upon your worked hours. So we have updated the PTO and the EIB guidelines to reflect that change, and you should have gotten notification from Relias on this to go out and to view that, and so that we know you've read through those changes. Orange Community Relations updates. You know, we're in a lot of the virtual activities right now. We're not able to get into facilities, many facilities. So our community education department up here on the Orange team has been sending care packages to our long-term care facilities and our pharmacies and EMS providers. They have shared their musical talents out on social media. We've gotten over 30,000 views on that. We've done costume parades at the facilities. The residents love these parades. We've gotten a lot of wonderful compliments from the long-term care facility staff. We have shared masks with our long-term care facilities. We've created memory books for them, pen pal cards. We're in the process of trying to get some virtual events off the ground for our community partners so that they stay educated. And we also have a Facebook Live planned on advanced directives. Volunteers from Shelley Black. We have had over 1,441 masks made by our volunteers. We pick up the masks and then we distribute those wherever they are needed. So volunteers have donated material, they've cut, they've sewn, and they've made enough masks to get us through several months into the future. We've also had volunteers sending cards to the long-term care facilities. So that's a nice surprise for the residents to be receiving cards. Community Ed is delivering those. Community relations on the blue team. We have delivered over 70 nurse survival kits to the long-term care facilities and physicians and clinics. Also, there's daily words of inspiration that are posted in the team areas regularly every day. We have Heroes Work Here signs that they are taking to various long-term care facilities and our referral sources, different locations. Those signs move around. Facebook postings also of the blue team. We have wings, and they've been getting their photographs with the angel wings. So the other thing that I wanted to mention, just a couple things briefly, I wanted to mention our annual report. And I know this will be posted out on the employee portal. This is for 2019. And I just wanted to mention a couple of items that are in here. We have right now approximately 116 employees. In 2019, we served 191 patients, and that equates to 69,744 patient days. So we took care of nearly 1,900 patients. It was 1,844 was the number of patients we took care of. We had 250 active volunteers in 2019, and they served 9,700 hours of service. Most of our revenue, as you know, comes from our patient care income. So 87% of the revenue for the organization is due to patient care. And then lastly, I wanted to mention two other items. So we always talk about how much of our money goes towards our programs. So for every dollar that we generate, 74 cents of every dollar goes to programs, which is great. The benchmark for the industry is 60 cents. So we are well above that 60 cents. And then lastly, I wanted to mention also that our paid staff made 4,500 bereavement contacts during 2019 and sent out 14,232 bereavement mailings. We are not reimbursed for bereavement type services through the government. So this is something, you know, we do for the community, and it's very well received. So anyway, that concludes our meeting. I just wanted to make sure that all of you, if you have any ideas that you would like to share or any concerns about COVID, please make sure that you go to the portal and put in your suggestions. I hope all of you take care of yourselves and take time to spend with your family and your loved ones. We hope this pandemic is going to be over soon. I want to thank you for all that you do, and I hope all of you have a good summer. Thank you.